Hi, Liz.
Hey.
Hi, Mercedes.
Hi, how are you guys?
Good. So I'm Susie Nitzel, and I'm the professional development coordinator. I think I've seen you up here and there.
Probably. I've been around a lot these last couple of weeks.
Exactly. And this is Liz Flores, and she's
Hi.
going to be facilitating.
Okay.
And Natalie Chavez is just coming into the room. Hi.
Unmute myself. Hi, everybody.
Hi.
Hey, is everybody here? Let's see. No, not yet.
Yes. No. So we should, once
5 people
Lynn,
are in our waiting room. Yeah.
let them in.
Okay.
I'm going to assign, Natalie, I'm giving you host duties.
Okay, cool.
Can I ask a quick question as the interpreter? Do you plan on spotlighting me the whole time or relying on those using the services to pin the video themselves?
I don't know what's the standard process for that. Do you normally have because we have a PowerPoint that's going to be going simultaneously. So
Yes.
I don't
So
know.
if the host or
For
co-host,
you?
they have, I'm sorry. If the
Okay, go ahead,
host
tell
or,
me.
oh, sorry. I think there's a bad time delay. If the host or co-host spotlights me, when the screen share comes up, I will be right to the right side of it and you'll see both at the same time, like that. Yeah, that's perfect. Otherwise, the video will jump to wherever it picks up audio. So I've seen it both ways. For recording purposes, it's nice if I'm spotlighted because if someone watches it later, they'll see me.
Right.
Otherwise, anyone using services would only see me if they were present here today.
Okay. So how do I do that? I don't know how to do that. I've never had an interpreter in my room before.
I feel like I'm spotlighted because it says that I'm spotlighted now, but there's 3 little dots at the top right corner of my video or on the participations list.
Oh, it says
all the names.
right there. It says, okay, you're there. It says cancel the spotlight video.
I went ahead and
Yeah.
pinned her. I spotlighted her
Already
and pinned her.
spotlighted.
Yeah.
Thank you so much, Elizabeth. I appreciate
You're
that.
welcome.
Okay.
Thanks, guys.
Okay.
Mercedes, will you be the only interpreter today?
She should not be, but it should be, because it's a lengthy session, we should have 2. So
Okay.
that she's not on screen the entire time.
Correct. If I have a team, it'll be about 20-minute increments, and we can message whoever's spotlighting the different interpreters. I can message them just to be like, hey, time to switch, or just to help kind of remind so you don't have to keep it on your mind with everything.
I think Liz is going to be able to do that. Liz,
Yeah,
can you spotlight?
Yeah.
Sounds perfect. So Liz will just contact you and just say, hey, can you swap? And when the other interpreter comes, I can identify them. You'll probably recognize them because they'll be playing background in a black shirt. It's usually how you can see us out of a crowd.
Okay, here we go. So people are joining. Hi, everybody. Welcome. We're gonna let everybody join us.
So I'm going to leave and go check on the other sessions. Don't forget to record.
Yeah. Yeah.
It looks like it's already recording. Yeah.
I think it's already recording right now.
Have fun.
Okay,
and that's fine. You can leave it recording. I'll edit later.
Thanks, Susie. Bye.
Good morning. This is Maria.
Hi, Maria. Welcome.
Hi.
Hi. I'm so glad to have you. I'll be the one sharing your PowerPoint.
Oh, awesome. Thank you.
So we're just going to wait for the rest of our participants to join us. So we have 8 more minutes. So feel free to get your coffee if you're just joining us. Get yourself comfortable. I'm just letting people in the room. Yeah, this is the presentation for Hope for Homeless Students. So just to make sure you're in the right place.
Okay. How many people are you expecting to join?
Yesterday we had 54 people.
Okay.
It might have been more since last night, but we had 54 yesterday.
Oh, okay.
Yeah.
And also I have a couple reminders for those of you who have a username as your name. If I can ask you guys to change it to your full name just so we know who you are, and that way you guys can get credit for attending this session. Also, if you're not one of the presenters or while you're speaking, if you can keep yourself muted, just that way we don't have all that background noise. Thank you, guys.
So we have 7 more minutes, guys. Just give it time. So I added something in the chat. If you all have a specific topic that you would like for us to address regarding homelessness today, I'd like for you to put it in the chat. And then I can make sure our WestCare partners and myself, before we end today's session, we try to address that question or have a conversation about it. So if you're coming in with an idea about homelessness that you're interested in learning about, if you could just write that in the chat right now as we're waiting, that'd be great. Okay, everybody. Hi and welcome. We're going to go ahead and start right on time because it's 11 o'clock and I know people are going to be joining us as we go. So welcome to our Hope for Homeless Students presentation. My name is Natalie Chavez and we're also joined by our community partner, WestCare California. So we're going to be here for the next hour presenting, and as I mentioned earlier, if you have specific questions regarding homelessness and your students, maybe challenges that you have faced or questions that you might have, if you could just include those in the chat, and then I can be sure to be addressing those throughout our presentation. So if you're thinking of something right now at the front end, let's just put those in the chat before we get started. So like I said, we're going to be starting with our presentation about the HOPE program at Fresno City, but really the majority of our information today is going to be coming from our WestCare partner. So I'm going to take this opportunity to kind of take the spotlight off of myself and just, like I said, I'm Natalie Chavez and I'm from Fresno City. So I am a faculty member at Fresno City and I'll give you more about my background in a minute, but I want to give an opportunity for our WestCare partners to also be able to introduce themselves. So Maria, did you want to introduce yourself?
Sure.
Go ahead.
Can you hear me?
Yes, you see.
I don't know why my camera is not working, so I apologize for that.
That's okay. We can hear your voice. So there you go.
Okay. So good morning. My name is Maria Rodriguez. I am the program director for housing services here at WestCare. I've been with WestCare for about 3 years or so. I started off as the community coordinator, so I was actually managing the homeless registry for Fresno and Madera counties. And about 18 months ago, I took over the director position.
Great. Okay. And then were there any other WestCare partners on the call today that are going to be also speaking with you? I didn't see anybody in the room, but I wasn't sure.
My understanding was that there was going to be someone else also presenting.
Yeah.
Yeah.
Well, it's me. So, I mean, it's you and you. So I didn't know if anybody else from WestCare was joining us. So I just want to make sure.
Okay.
Is there anybody else in here from WestCare? This is your chance. Okay. If not, then this is okay. So it's me and Maria. So I'm going to go ahead and get started, Maria, and then I'm going to go into your PowerPoint just so I can start us off with an introduction. So again, my name is Natalie Chavez, and I have been a full-time faculty member at Fresno City for the last 8 years. Just to give you a little bit of background before we start this presentation today. So my work has primarily been focused with foster youth. So some of you may know me because I actually oversee several programs that actually support young people who are current and former foster youth. So that really introduced me into the world of homelessness, because if you work with the population of young people in care, that is a frequent kind of experience for our young people who are coming out of foster care. So it was really early on that I recognized there was a huge need for homeless support. And so that led me down the road of trying to understand what resources were available for our homeless students. And I was really discouraged to find that there wasn't a lot, to be honest. And so it set me on a path to start to develop what we are now calling our HOPE program. So this has been in the works for several years, and now we are recipients of a couple of huge grants. I won't go down the road of funding too much, but basically it's a multi-million-dollar, multi-year program that we are now being funded by two primary sources. One is from the federal government, and then one is also from the chancellor's office. So today what we're going to be presenting you on is just a general introduction into the HOPE program, which is Housing Opportunities Promote Education. It's such at the beginning stages that I don't feel comfortable giving you specifics. And today's presentation is not about a program, it's about us understanding homelessness. So just to be clear, we are going to be discussing homeless students at Fresno City, but we're also just going to be discussing homelessness in general in the Fresno community, because this is going to be a huge partnership between Fresno City and our community providers. And so we're thankful that WestCare was able to join us, and we're really happy to have Maria here, so, and her expertise. So just to give you a little bit of a glimpse into what's going to be coming in the next few years for you faculty or people who are joining this presentation, my guess is that you're interested because you might actually have a homeless student that you are supporting or you're trying to find resources for. And so I'm going to be showing you a little bit about what we are hoping to do in the next few years. So like I said, our program is called HOPE. And really what the goal of the program is to pilot a sustainable FCC homeless services service program for students through the following. So what we're trying to do is we are going to distribute 1.68 million total funding directly to students through their financial aid to prevent homelessness and to provide rental down payments and also rental subsidies. So that 1.68 million will be dispersed over the next 3 years, and it's actually going to be distributed through their financial aid award. So we're in the middle of setting that up with our financial aid office. Obviously, it's a huge undertaking because we've never ever had this type of support before. So this will all be calculated through their financial aid award amounts and their unmet need. And that's all financial aid talk that I'm learning right now because I never really knew very much about financial aid. I mean, I understood the basics, but what we're going to have eventually for every student is that every student will have a certain amount of funds that they're eligible for subsidy, which will mean we could, in essence, support a portion of their rent up to 6 months. So we're structuring that program right now and how that's going to look. And then we are going to establish sustainable partnerships with community service homeless providers to link students to emergency and long-term housing resources. So homelessness doesn't just start just all of a sudden. There were a lot of contributing factors that led to a person becoming homeless. So we are going to need these service providers in the community to link these students to the supportive services that might be contributing to their homeless situation, meaning maybe there is some sort of larger mental health issue that could be a barrier causing them some challenges. Maybe there's some alcohol and drug treatment that's needed. These homeless service providers also provide the housing navigation services. So the college is not going to become a housing provider. We don't have that kind of capacity or expertise, but we're looking at how we are building these partnerships with the community. So that will also be about the strategic planning of partnerships with private sector developers to increase access for students to affordable housing. There just aren't very many apartments available in the Fresno area that are affordable for students. So the good news is that we have a huge amount of interest from donors, from the Housing Authority, from some of these major players that actually want to build housing specifically for our student population. So Dr. Goldsmith, as well as myself and the administration, are looking at how can we nurture these relationships and build these types of partnerships where our students could have first access to these affordable housing, apartment complexes and locations where we know that they can actually rent at an affordable rate and potentially get even preference. So those conversations are happening. They're at the very beginning stages because, like I said, we just got awarded in April. So it's very early. But we're optimistic. And so what you can look forward to is, as you hear more about HOPE, we're going to be sharing with you all as a staff and as a larger FCC community about our services, what's available to students, and more importantly, how do you refer students directly? So I'm thinking from a faculty perspective, if you have a student that you're working with, what is the easiest way for you to be able to refer your student to be able to get support? And that's my goal in the next 3 years as we're building this partnership, is how do I make it something that's accessible to everyone? So that's in the building phases right now. And so these are some of the things that we're focused upon right now, is that we're really looking at furthering some of our social justice and student equity work by focusing specifically on these impacted student groups. So specifically, we're looking at foster youth, veterans, students with disabilities, formerly incarcerated students, LGBT students, and then disproportionately impacted racial groups, including the listed groups below there that were identified in our student equity plan. So we're really looking at how can we target those most vulnerable populations to prioritize them for services. And I don't want to make it seem as though they're going to be at the front of the line. That's not the case. But these are some of the students that we know are most vulnerable. So we're going to be partnering with different parts of the campus in order for us to tap into referrals and those kinds of things. So as we grow, the HOPE program is going to have multiple kinds of specialties underneath the HOPE program. So Right now we have another grant that I mentioned that's going to be specifically for foster youth. And then we're going to have other parts of the program that are specifically for veterans, and specifically because there are people in the community that support all those different populations. So the goal in the next 3 years is that we'll have all these umbrella of services that will be available, and we can easily plug in students to all of these different resources once these relationships exist. So all you faculty and people who are here, all you need to know is once you make a referral to Hope, those wheels are in motion for those students to be able to access those funds from their financial aid and to be able to connect to that affordable housing and those supportive services in the community. So all of that's going to be built within the next 3 years. And that's the hope. So let me take a moment. I'm going to go ahead and check out our chat because I know that we've got things going on here, and I'm going to address some of these questions here. So it looks like Linda Vang, let's see. These are all positive kind of comments. Thank you guys for all the positive comments. I'm just asking if anybody has any questions at this point, if you guys could just go ahead and, unmute yourself, or you can, I don't really know how you want to do it. It's a pretty large group, so you can put it in the chat, or do you have anything that anybody so far have questions?
Natalie, it's me, Linda Vang.
Hi, Linda Vang.
I'm just so thrilled about this. I'm so excited. Thank you. I would love to support this in any way that I could. Would you be talking about how we will do the referral for Hope? Like, what's the process?
Well, that's a good question. And I think that that's going to be up for conversation because at this point, it's so early. I can't really take on the referrals yet just because these partnerships are just being developed. And so that was going to be a question I was actually going to ask of you all as a group to kind of have a conversation about was, as faculty, what would be the easiest way for you to refer them to us? In your mind, do you feel like an online form would be a good way to go? Do you think that, I don't know, does anybody have any ideas about that? Because at this point, it could be anything. We could make any kind of decisions about how the referral process could go. So what do you think would be the easiest way for you all to make that connection to us? What would you like to see?
What about Starfish?
We are going to be using Starfish to track all of our data. So we have a certain section. So Kayla Mannon, I'm so glad I can see her name here. She's working with us to help. We're just starting to actually do Starfish. So we chose Starfish as intentionally because we want to be totally transparent about what we're providing to students. Obviously not violating confidentiality. But yeah, so was that what you were thinking with Starfish?
I meant referring students through the early alert part of it.
Ooh, I hadn't thought about that. So can you kind of talk a little bit more? How would that look? What would that look like?
Because when faculty go in, we can, for instance, we can talk about, as I understand it, although I haven't used it yet, I've just gone through training, flex trainings. I think that we can indicate challenges a student might have, or it might, and someone feel free to jump in and clarify or correct what I'm saying.
Right.
But basically, I don't know if maybe, or if there could be an addition where we could check, for instance, this is a foster youth student or a student, formerly incarcerated student, and it would go, that would go to then the Hope program.
Okay. I love that idea. And I may follow up with you after this because I love that idea. So no idea is bad at this point. Like, I want this to be as user-friendly as possible. So we're at the front end, we can build it any way we want it to be. So I'm going to make a note of that, like right now, just because I think that's a great idea. And now that we're building our Starfish identity, we're going to have our own identity. Hope is going to have its own Starfish identity. So we can incorporate that. I'm seeing a couple, and I see Kayla actually said, yes, we could do that kind of referral. So that's nice to know. Okay. And I see that, yeah, go ahead.
This is Marisol. I think Starfish would be a really good idea, but I also think that a lot of faculty don't use Starfish or aren't familiar with it. So I think something as uninvasive as possible and quick as possible, like an online forum, when you said that, I think that would be really helpful.
We could do both. There'll be two streams coming at the same time.
Yeah, and confidential. So, and students have a really difficult time if they're not going through, if they have something like, if they have a mental illness or something, they're not going through DSPNS, they feel really uncomfortable, with going through the modes of the bureaucracy of the system, right? So I think a really good thing would be like an online form, or like an, you know, when you call DSPNS or you call a certain service and you say, hey, you know, and with that person there, and just walk them down to a physical place on campus once we get to that point.
Perfect.
I like the idea of both a flag in early alert and an online form.
Yeah.
That way, like for instance,
We can cover all the bases.
search.
Mhm.
Yeah, we could go by whichever or whatever the student might be most comfortable with.
Yeah.
And we don't have to.
Yeah. Yeah, and I see here Melody Cox had a good one, an online button in Student Hub, the Student Support Hub. Good job, Melody. That's another good one with the Student Support Hub. That's an interesting idea. So I could talk to tech support about that. So I'm going to answer this question here from Elise, and then we're going to get ready to get started with Maria. So I'm trying to take questions as I see them. So she says here, Elise says, will the program consider specific services for the previously incarcerated, recently released homeless students? I have had students from have been released from prison with no network of support and attend FCC as a homeless student, doing most of their work with the government issue phone. Funny you should ask that. One of my counselors is actually funded specifically to work with formerly incarcerated students. So that's his full-time focus. It's one of his primary groups. And so this summer we've been doing outreach specifically to that population. We've been working really closely with the UPS and really gleaning a referral of services of people that we know are recently released, and we were doing outreach to that particular population. So they're highest on our list. So the model that we're taking in is a very different type of housing model. So it's not very popular in Fresno from what I understand, but it's actually the idea of rapid rehousing. I had never really heard of the model before, but this is what the chancellor's office is encouraging us to use. The idea is that students are put immediately into stable housing instead of going into a shelter. And that is regardless of criminal background, income stability, and all those different components that normally had to be in place. And then you actually support the student to get stable over the 6 months that we're actually supporting them. So it's a very different model than what was kind of thought of in the past, which would eliminate a lot of barriers, especially for our most vulnerable students. So we're talking to our partners as to how can this look in Fresno, because even though the chancellor is kind of proposing this, we have to see how can we adapt that to our community so it works for us. But that would really remove a lot of those barriers that a lot of our students who have been chronically homeless or have had a lot of challenges, we could really connect them to housing more quickly instead of them having to go through all of these different barriers that they used to have to do in the past. So I'm going to just check here if there's anything. Yeah, multiple ways to refer. I think we addressed that. And refer homeless this semester. Okay. So what I'm going to do is it through psych services office? Let me see, Natalie, what is the best way to refer homeless students to help this semester before Hopes gets going? Well, I mean, I know that people are chomping at the bit. We can take the note of the student. Like I said, I would be lying to you if I said that all this was set up. That's not true. I would say the best thing to do if you have a student at this point would just be to email me directly your student name, and then I can take it from there and assign it to the appropriate person. It's not sophisticated, I know, guys, but it's the best that we can do at this point. So if you have a student that you're really concerned about, you can email me that student name, and then I will assign it to one of we have Hope coaches. We have actually 4 Hope coaches that are funded under my program. And then those people can do outreach to those students and figure out how we can support them best while we're building the program. So for right now, as we're building all these other referral services, if you could just individually email me the name, I'll take it from there. Like I said, it's not sophisticated, but it's the best we can do for the moment. Okay. So at this point, I'm just gonna take myself off here, and I'm gonna go ahead and bring up the PowerPoint for our friend Maria. So Maria, if you want to go ahead and start. Let me just get out of that. Okay, sorry, Maria. If you want to go ahead and start, just kind of introducing yourself. I'm gonna open your presentation right now. If you're ready to go, Maria. Are you there?
There you go. Sorry, I was muted.
Were you muted? Okay, there you go. Start you right now. Go ahead.
Good morning. So I was able to get my camera to work, so that was great.
Nice.
So yeah, just like I mentioned earlier, so I've been in the homeless world for about 3.5 years or so. I did start as a community coordinator, so that gave me a lot of opportunity to work with frontline staff that are conducting outreach to the homeless, literally going to homeless encampments with housing providers who were the ones housing people that are experiencing homelessness through a coordinated entry system, and really was able to work with many of the partners that are part of the Fresno Madera Continuum of Care. So the Fresno Madera Continuum of Care is comprised of over 30 different entities that at one point or another, they provide services to people that are experiencing homelessness. So I have been able to take part of that. I'm also the community lead for the Built for Zero homelessness initiative to end homelessness here in Fresno and Madera counties. We've conducted a couple of tests in the community to see how we can improve our system, and we continue to do that on once a quarter, just to basically try to improve the system that we currently have. I can't say that it's the best system, but we have drastically made improvements to ensure that people experiencing homelessness are able to access the resources that they need much faster and in a much smoother and streamlined way.
So if you want to tell me, Maria, I'll run your PowerPoint, but you just tell me next slide when you're ready to go.
Okay,
So
all right, so we'll start with the first slide.
Okay.
Since we are talking about homelessness and unstable housing, I do want to just kind of provide a brief clarification, because I often get calls myself for people that are saying, hey, I'm experiencing homelessness. And when I actually ask more in-depth questions, in reality, for how to fund their programs, they're not necessarily experiencing homelessness. They're more considered to be unstably housed. And so I think that makes a big difference, because depending on their depending on their housing situation or their housing status when they contact us, we basically assess and determine what would be the best housing intervention for them, or what program would be the best intervention to assist the current needs of the families or the individuals that contact us. So in homelessness, people that are experiencing homelessness for us is that they are people that are living outside on the streets. They're literally, those are the people that you see when you're driving by the highway. They're sleeping next to the freeway. People that are staying in their vehicles. Oftentimes people, that's all they have. And so they'll be sleeping in the vehicles in the Walmart parking lot. In emergency shelters. We have here in Fresno and Madera counties, we opened 4 different triage centers, which brought more than 100 emergency shelter beds to the Fresno County. And so, and aside from that, we already had a couple more of emergency shelters. Some of them were the Fresno Rescue Mission, Poverello House, which I think some people were posting about. I'll talk a little bit more about them also, because they are part of our coordinated entry system. People that are experiencing or staying in shelters due to being victims of domestic violence, though they are considered to be literally homeless, even if they just left their house. Motel paid by a voucher, so oftentimes, more specifically, we see it with families that get a voucher from the Department of Social Services if they have children or part of the CalWorks program. They get a motel for about 16 days, and they're able to stay at a motel in a safe place where they can sleep while still looking for a unit that will be more permanent for them to move into. You have transitional housing programs. They are considered homeless because without a transitional housing program, that means that the individual or the family would essentially be literally homeless if there was no funding for the transitional housing programs. And then when we look at the unstably housed, so those are more people that are staying at the friend's house or the family just for a short period of time. We often call it couch surfing. So when someone is going, like staying 2 days with one friend, 3 days with the other, 4 days with another friend, then they go back to the family for less than 7 days. That essentially is their housing situation is very unstable. But technically speaking, they're not literally homeless based on the definition that we use for most of our programs. For friends and family, again, even if they're staying with their family or their friends for a long period of time, but they don't really have a lease, they're not really in part of the mortgage, they have nothing signed of a document that states that that's their permanent home. We consider that to be unstably housed, because any situation can happen where there's an argument or they might end up getting kicked out and they can immediately go into the homeless category. For people, some people actually work and have income, but they're unable to, they haven't been able to either find an apartment to stay in. So they end up staying in a motel or a hotel that they pay for. For us, because they are paying for the motel themselves, they are considered to be unstably housed rather than experiencing homelessness. People that are staying at the hospitals, there's some people that stay there for weeks, some of them even months. And so they are considered unstably housed. If they don't have a place to go to after they're released from the hospital, then essentially, their housing they're experiencing a housing instability. The same thing for people that are in jail or prison. For us, if we're working with someone through the coordinated entry system and they end up going to jail or to prison and we know that they're gonna be there for more than 90 days, we recategorize them from literally homeless or unsheltered to give me one second. So we recategorize them from experiencing homelessness or being unsheltered to being temporarily housed. And that is because they're gonna be there for more than 90 days and that will add a break into their homelessness. So once they are released, they will have to reestablish homelessness. And I'll talk a little bit more about it in my presentation. The same thing for people that are staying in a psychiatric treatment or a substance use facility. Oftentimes treatment programs are about 90 days. So if individuals go into these treatment facilities and they're there the full term of the treatment, which is 90 days or plus, they're considered to be unstably housed because technically they're housed even though they're in a treatment. And so oftentimes when they're in treatment, they don't really qualify for some of the housing programs that we have because the requirement for those programs is for them to be literally homeless. Next slide. Okay, sorry. I gotta move some things around. Okay, all right. So this next slide, I think we skipped one.
Did we?
Yeah.
No, that's the next one.
Can you go, I might have them backwards in mine. Can you go to the next one? There you go. Yeah, and then we'll go back to the other one, sorry.
Okay.
Okay, so I'm gonna talk a little bit more since people that are going to community college tend to be within this age range. So I'm gonna focus a little bit on this data right here. So this is some data that we derived from the point in time count that was conducted in January of 2019. I don't have the numbers for the 2020 point in time count, so I'm gonna use the 2019. So in regards to people within the ages of 18 to 24 census, looking at the chart, it shows that at the time that we did the point in time, 15 youth or individuals within the ages of 18 to 24 were experiencing homelessness, but they were actually in an emergency shelter. 7 of them were in a transitional housing program, and 106 of them were counted as being unsheltered. So meaning they could have been in the car, they could have been in an emergency shelter, they could have been literally out in the street, they could have been in any place that we consider a place not meant for human habitation. So overall, the data showed us that we had 128 people experiencing homelessness within the ages of 18 to 24.
Can you explain what the point in time
Yes.
is?
So the point in time count it's actually mandated by HUD. So they mandate it for the continuum of care to complete it every 2 years. However, Fresno and Madera counties have opted to do it every single year. And it usually happens on the last 3 days or the last 3 days of January. So we here in Fresno and Madera counties, we do it 3 days. So the first day we do a visual count where like you go with a group of people, you get a map and we divide it by different zip codes. So you get assigned a zip code, you go out in Fresno or Madera, depending on the area that you get, and you literally drive every single street, you go through the different alleys, you go through the different locations where you're able to, anytime that you see someone that fits the categories of someone that's experiencing homelessness, we count them. The second day, you get the same map, you go to the same locations, you go to the same areas where you've seen people that could have potentially been experiencing homelessness, and you actually conduct surveys. The surveys allowed us to really get more of the demographic information to identify the ages, to identify the race, the ethnicities of the people that are experiencing homelessness at that given time. And it might seem weird of why we do it the last 3 days of January, but for HUD, it's essentially those are considered to be the coldest nights of the winter. And so for them is if someone is truly experiencing homelessness, you're either gonna find them in an emergency shelter or they're literally gonna be out in the street. Of course, that could be erroneous and it might not provide us exact data, but that's basically what we go off.
So do you feel like this number could actually be larger? I mean, just because you couldn't capture everybody in that point in time survey?
Yes. Yeah, definitely. It can be, because if someone, for example, I know I talked earlier about someone, if it's really cold, I might ask my friend, hey, can I stay with you tonight? And they say yes. And so that night that we're out doing the point in time count, and we're actually doing a visual count of people, if I stay with my friend, I'm not going to be counted. And that doesn't necessarily mean that I'm not experiencing homelessness. It just means that, hey, this one night they allowed me to stay with them. And so there is a possibility that person did not get counted.
Mm. Okay.
But that's the method that they use. And I know that there's a specific formula, which I'm not 100% on how to explain that formula. And there's a methodology that they use to kind of get a good estimate about how many people are experiencing homelessness within that time frame. And since I am talking the point in time count, I know that it is coming up within a couple of months. So if anybody would want to participate, you can always contact me, and I can point you to the person who'll be taking over the point in time count. It really does provide a different perspective of people that are experiencing homelessness, and it allows you to connect with them, and it's actually a very rewarding experience and very eye-opening in my opinion. So keep that in mind. It happens every January.
Okay.
Next.
All right. You have the previous one to go back to the okay.
Okay. So, of course, so talking about 100 plus people within the ages of 18 to 24 experiencing homelessness, it is a high number for the age range. But there's a reason for that. And this talks a little bit about the rental vacancy rate here in Fresno. So it can be an indicator of why that might be. So looking at this information, if we look at Fresno, the average in 2017, this was the most recent data that I could gather. Our vacancy rate here in Fresno is 3.12%. So it's way lower than the US national rental vacancy rate, which is 6.18%. And in California, the rental vacancy rate is 3.49. So it's even way below that. So you're able to see that. So having a low vacancy rate makes it very difficult for us to find even youth or just really any individual or families that are experiencing homelessness to get them linked to a unit. Now, on top of this, we also have other barriers that our clients already come with. So not to mention that they might have evictions in the record, they might have a criminal record, they might not have any income. And so that makes it really difficult for us to advocate for our clients to the property managers or the private owners to say, hey, would you allow my client to rent a unit from you? We're gonna help, and we're gonna provide the case management, and we're gonna provide the wraparound services. Even though sometimes we always offer a double deposit to make it more enticing for them to want to work with our programs, it is a little difficult. And then having such a low vacancy rate makes it that much more. Also, a lot of our programs operate on paying apartment units that are within the fair market rent value. And sometimes when they're higher, then we're unable to pay for those. Okay, next one. All right. So I talked a little bit about when I was a community coordinator, I actually managed what we call the by name list. Essentially, the by name list is a homeless registry here for Fresno and Madera counties. It allows us to track the real-time data to know the client's current housing status and their needs. It allows us to prioritize the limited resources for the most vulnerable population. And it also measures the progress towards the community goals and how close as a community we are to reaching an end to homelessness among the different subpopulations. The subpopulations that I'm referring to are families, veterans, youth, chronic individuals, and other individuals that are literally homeless. So currently we have 1,437 people enter in our registry. Now, these are the people that at one point or another completed a vulnerability survey to allow us to identify their needs. Actively in the by name list, we have 348. And what that means is that 348 people, whether they're families, individuals, chronic, from any of the subpopulations, or actively working with a navigator. The navigator or a case manager are the ones that help them basically provide guidance through our coordinated entry system. They provide transportation, they provide assistance on getting any IDs, birth certificates, etc. There's 9 people that were matched, but we're not 94 people that have been matched and then not housed. Now, this is a high number of people that are matched. When someone is matched through coordinated entry system, it means that the client has already gathered all the documentation. They met criteria for a housing program. They were screened and enrolled in that program. And now the case manager is working on identifying a unit to be able to place the family or the individual. Currently, we have 94 people that are actively searching for apartments. Total permanently housed recorded in our registry is 670 people. Now, this might not account for all of those families that came and ended up going to receive HSP voucher assistance through the county. Sometimes we provide assistance, but they might not necessarily complete the survey for them to be added to the by name list. And transitional age youth, we only had 19 people recorded in the by name list. Now, if we look at the other data, I said that we had 100 plus of people within the ages of 18 to 24 experiencing homelessness. And that's what we captured during the point in time count. Our actual registry only is accounting for 19 of them. And that could be for various reasons. One of them could be that when people are staying in transitional housing, oftentimes the plan for the youth is to family reunification. So they'll try to work with the family first and the individual to get them to go back home. They might opt to tap into other resources prior to actually entering them into the homeless system. So that's why there's that difference. So it means that only 19 of those 100 plus people have actually had contact with the coordinated entry system and have been assessed for their needs. Next. Okay. And so what is our coordinated entry system? So our coordinated entry system essentially is our homeless response system. Prior to 1995, every agency that provided services to the homeless, every agency that provided services to people experiencing homelessness would directly apply for funding to the federal government. As of 1995, they made it mandatory that continuums needed to be formed or counties needed to come together and apply in one consolidated application. So for us, it's Fresno and Madera counties. We do one consolidated application where we apply for federal funding, and then you have your internal process of applying through the Fresno Madera Continuum of Care to be able to access that funding. So it really allowed for communities to streamline those resources. If you look at the first graphic without coordinated entry, like the ultimate goal is the middle, which is the house, right? Everybody wants to get housed, but it was like a maze. There was really no streamlined way of, well, how do I get to my goal? And which paths do I have to go? What agencies do I need to contact? And everybody, it was just very chaotic. So the coordinated entry system really allowed us to streamline that process to where now we have different access sites, which I included in this PowerPoint at the end, where people go, they get assessed. We are now conducting an initial screening tool, which allows us to gather client information. We immediately enter them into the system to know that if they were diverted right at the front door, and then they come back a month later, we're able to go back and look at the data and say, okay, where did they get diverted to, and why was it that they came back into the system? Why did that intervention initially did not work? And now we have to provide a different one. So we're starting to gather a lot more data to really allow us to continue to improve the system. Once they're assessed, they complete the survey, they get entered into a registry or the by name list, and they're assigned a navigator. So the navigator essentially is the one providing client service to each individual or family that's experiencing homelessness. They'll, like I mentioned before, they help with transportation, they help getting any documentation. If we have to pay for it, some programs have the ability to provide the funding to pay for applications. We do that. We help them with apartment applications, pay for IDs if needed. Otherwise, we'll get them a waiver, which will allow them to get a free ID as well. And once the navigator has gathered all the documentation that the client is going to need, they're able to determine, they submit a housing application referral. when they do that, or Housing Matcher, which is also here at WestCare, she looks at the application and also identifies our housing stock within the continuum of care. From there, she determines, based on the client's needs, this would be the best housing intervention program for them, and the client gets matched to the housing provider. And then ultimately, it is the housing provider, the case manager's responsibility to work together with the navigator to ensure that they continue to provide those wraparound services to the client until they get permanently placed. Next. Okay. So I pretty much already covered this. Again, the coordinated entry system allowed us to effectively identify and prioritize the most vulnerable in the community for services and housing. I did mention that we do have a low vacancy rate here in Fresno, and also within the permanent supportive housing programs, oftentimes the capacity is limited in here in Fresno and Madera counties. So it also ensures that everyone that has fair and equal access to services and supports. Can you go back one more slide? Sorry. Support that they need for accessing housing. So in the past, people, it was more like a first come, first serve type of basis. Now we actually look at the client's needs, and we look at the length of homelessness. We look at the vulnerability score that they have. So essentially, the coordinated entry system allows us to prioritize for the most vulnerable, or what we say, the people that are more likely to die out in the street if we don't provide immediate housing interventions. Next. Okay. And so this is essentially a visual of the coordinated entry flow chart. I basically touched bases in some of this, but I'll briefly touch on them. So diversion. Diversion essentially, if someone is experiencing a housing crisis, they'll go to one of the access sites. Depending on the client's situation, they will always try to ask them questions of, you know, if it's someone, have you talked to any relatives? Do you have any family members that you can go stay at? While we continue to provide services, but you can be in a safe house in the meantime. You know, people that come and they might qualify for a voucher. So have you tapped into that voucher to see if we can put you in a hotel so that you can be in a safer place rather than be staying out on the street? All of the access sites will practice diversion. It's more an in-depth conversation and problem-solving conversation we have with the client to basically look to see if they have any other resources before we start tapping into our home or coordinated entry resources that we have. Once they go to the access site, again, they'll be assessed for their needs. If they determine that the client doesn't have any resources, there's no way to divert them, we'll try to put them in a triage center or an emergency shelter bed so they can at least spend the night there or stay. The triage now allows people to stay there for up to 90 days. So if they're able to stay there, it's good for us because we're able to go back and connect with them and we know exactly where they're at. So if we need to do anything, we can just go look for them at that location. Once they get the vulnerability survey completed, they get entered into the by name list, which I already mentioned prior. That's when they get assigned a navigator. So the navigator will be the one working with the client until they essentially get housed. And the by name list, again, just to recap, it allows us to prioritize those who are the most vulnerable. Currently, we look at the length of time someone has been out in the streets. We look at how vulnerable they are based on their acuity score. And we also look at the severity of the needs. So those are the highest in our list. And then we basically go down from there. Once a client has gathered all the documentation, been working with the navigator submits a housing matching referral. Or housing matcher looks at our housing stock or housing availabilities, and she matches the client to the best housing intervention available. And once that happens, the housing provider will essentially work with the client until they identify a unit where they can move in and they can have a more safe and permanent housing placement. Next. Okay. So these are some of the entities that are currently part of the Fresno Madera continuum of care. We divided it by government entities such as the City of Fresno, City of Clovis, Community of Fresno, County of Fresno. We also have veteran services. Now, some of these agencies provide different services that could be added to the different domains that we have here. We just put them where they basically are more known for. So So that just pretty much gives you a visual of the agencies that we work with. Essentially, all of these agencies, we work together in the coordinated entry system. So if someone comes through an access site, at one point or another, depending on their needs, they might be referred or linked to any of these entities. Okay. And then housing interventions, again, self-resolution would mean that the client has the funding, they have the ability or the resources to be able to self-resolve on their own, meaning that they don't have any other type of assistance. Homeless prevention. So homeless prevention is used, and we do have a program that has that type of funding here at WestCare. Is it provides basically it provides financial assistance for people to regain their stability. So for example, if someone like right now with COVID, many people lost their jobs and were not able to keep generating the income that they used to have. So if they were to get a 30-day notice, and they contact us saying, hey, I have a 30-day notice. I wasn't able to pay because I stopped working for 2 months, but I'm gonna be receiving unemployment benefits. I'm in the process of getting that going. Then essentially we assess the need, and we're able to provide financial assistance, meaning that we can catch them up on the rental assistance that they owe, or the rental amount that they owe, and provide that rental assistance to them so that they can regain that stability. With homeless prevention, we do have to just make sure that after we provide that assistance, the family or the individual is going to be able to self-sustain after that. Because if they're going to go back to getting an eviction, then perhaps that's not the best housing intervention. Diversion, diversion, I'll explain both ways. So traditional diversion just means that, again, you have the end of conversation. It's a problem-solving conversation that we have with the individual to allow them to access resources that they already have, but due to the housing crisis that they're experiencing, they might not really be thinking about it, right? So we just have that conversation with them, like, well, have you contacted this person? Have you accessed this resource? And if they don't, we kind of help them access those resources. But we also have a program within WestCare that is our diversion program. And through our diversion program, it's actually funded by the County of Fresno, and we are able to provide financial support to those people that are at risk of homelessness or that are newly experiencing homelessness. So people that have a 3-day notice, we're able to, again, similar to homeless prevention, go back, talk to the landlord, say, hey, if we're able to catch them up and pay their balance, they're gonna be able to continue paying the rent. Can you allow us to work with you so that we can pay that amount, and then the client can just continue to pay the rent. If they're already experiencing homelessness, we usually try to aim for like a 30-day window of rapidly exiting that person back into permanent and safe placement. In our diversion team, we just completed our first fiscal year, and that is a pilot program as well. We were able to house, we provided services to over 300 people within the first year. So it has been a very successful program for us. Rapid rehousing assistance, that provides more of short-term rental assistance. So for example, any rapid rehousing program will probably assist with a double deposit. The rental assistance will vary from 3 months all the way to up to 24 months, depending on the program and depending on what their contract states. But per HUD, you can use ESG money to pay rapid rehousing assistance for up to 24 months. And permanent supportive housing programs, those are essentially programs that are for people that are the most vulnerable, the highest needs, higher acuity scores, because they're the ones that have either they'll have a disability, they really need more of that intensive case management. And these permanent supportive housing programs don't have a time frame of you could only be here for a year or 2 years. People can be in those programs indefinitely for as long as the program continues to get funded and getting that intensive case management. Next. Okay. And so now how to access the coordinated entry system. And I think somebody had mentioned about MAP earlier. So MAP is one of our access sites. They are part of our coordinated entry system. So if you know of someone that's experiencing homelessness right now, or that are at imminent risk of becoming homeless or have some sort of housing crisis or housing instability, they can always go to MAP and they will complete the screening tool to assess their needs. They can go to Naomi's House for Shelter for women. The Welcome Center is a triage that recently opened within the last couple of months. And it has, I didn't put the phone number for that one, but I can probably send it out. The Welcome Center, people can go there as well. If there's beds available, then they'll be able to stay there. If there's not, they usually contact the other triage centers to try to get bed availability so that we can link any 1% team at any of the sites to get them linked to a safe bed, at least for that one night. Once you enter any of the triage centers, you can stay there for up to 90 days. And within those 90 days, you'll have people working with you. You'll get like I mentioned, you get a navigator assigned so that they can be working with you based on your needs. And the ultimate goal is that within that time frame, we're able to get them ready to move into their own place. Golden State Triage Center, that's also by Turning Point. And then for youth 18 to 24, Sanctuary Transitional Shelter and the Youth Rich Housing from EOC, those are the locations and the phone number that they provided. They actually said that anyone can actually just text and they'll respond back based on their needs. So if someone even did not want to call them, they could always text it, and that makes, if it makes it easier for them to contact anyone to get to be seeking assistance. And I think that's it.
Mute myself. Hi, sorry, I for a second. Sorry about that. Okay, so I'm just going to take us back here. So just to wrap us up, guys, I'm going to take us back to my presentation just to show you. So a lot of people are asking, why would a college serve homeless students? So this is how I want you all to think about it. So thank you to our WestCare partner for presenting all that. We could never, ever build the coordinated entry system that's already existing. It's so sophisticated. They've spent decades trying to build it. So now what we're going to do is FCC is going to identify our homeless students. So one of the things that we're doing to identify our homeless students is we're actually going to be releasing a homelessness survey of all 38,000 students that are enrolled. So we can establish a baseline of homelessness for our students. And from there, we're actually going to prioritize from there those students that are in imminent risk of being homeless, that are actively homeless, and then we'll actually know what is our homelessness snapshot, for lack of better terms, for our campus. And on that questionnaire that's going to be released in the survey, we actually ask a specific question: was your housing impacted by COVID-19? So we have a fair amount of students that are going to lose housing because of the fact that they couldn't work. So then from that list, we're going to be prioritizing those students to access those funds right away. Because we know they're in imminent risk of being homeless, and potentially we could secure their housing, you know, before they actually become homeless. So like I said, the FCC Hope Fund, it's going to be an award through their financial aid, and all of that is kind of out of our hands about what they'll be eligible for. But once those Hope Funds become awarded to them, we're going to actually work with them to help them understand. They get the check from us, and then we're helping to work with them to learn about that, you know, maybe they need credit recovery, maybe they need some sort of other financial education, those kinds of things. So we're building those partnerships. So we're giving them the check, but it's not just about giving them money. We have these community partnerships that we can utilize to help them learn about, you know, maybe some things that they needed to do to get themselves out of whatever the hole is that they're in. And then we're actually going to track our student data. So the goal in 3 years, well, actually it's 5 years total for all of our homeless programs, is that I want to actually have a longitudinal study. So we're going to start with our homelessness baseline in year 1, and then we're going to continually release the survey to get those snapshots in time. And eventually, based on the students that we serve, we actually want to link housing stability to academic outcomes, which has never really been done before. So if we can actually connect that housing stability or the interventions that students receive, and we know that they have reached permanent housing, can we actually see a change in their GPA? Can we see a change in persistence? Can we see a change in their retention? So that's kind of the dream. And that's where we're moving with our research. So we're starting with FCC on the inside, but we're building from the inside out. So we're building that network of community homeless service providers, which would be like a WestCare, and there's a whole wealth of resources in Fresno County. So ideally what's going to happen at the end of the 3 years is we're going to have an existing memorandums of understanding with all of these organizations. So this coordinated entry system is a glimpse into what WestCare is sharing with us, but there's a whole wealth of other resources that we can categorize and have available to us, so we can leverage the funds that we're giving students to those services that are being provided into the community. And the goal is that then they can get the most robust amount of support, because we could never do that as a campus. But if we leverage our resources with the community, we know we can build a stronger program. And then ideally, we have a significant amount of interest from donors, like I said, that want to actually build affordable housing, because that's where we need to go in our community. You saw our vacancy rate is so low. So we actually need more developments of large complexes that could be available. And potentially those complexes could be just for FCC students. So we've had multiple large donors who want to do that, and we're having those conversations right now. We're in the middle of having meetings with our housing authority, because ideally what we'd love to do is have a memorandum of understanding between us and the housing authority, where we could actually have additional Section 8 vouchers that could actually be issued. So if we can leverage our resources with them. So there's a lot that's going to be happening in the next few years, and I know this is just the beginning. So when you see homeless stuff, you're going to see the progress of our growth, because like I said, we were awarded April 15th, so it's a very new process for us. So for right now, I would really appreciate if you all could just reach out to me. I know it's not ideal, but if you know that you have a student that's struggling, I'll have we call them hope coaches, connect those students to some of these resources that you saw through the coordinated entry and all those partnerships. We can take the lead in linking those students. So I don't want you to feel like you have to take that on. The goal is that we are going to be the liaison between us and the community to link these students to those housing resources. So at this point, I think we have a few minutes for questions. If anybody wants to just jump in there, you guys, I don't think I have you muted. Let me check our chat. Let me see. There's one here. It said, will undocumented students have access to this support or funding since it's connected to financial aid? No. So yeah, so part of, so I don't want to say anything wrong here, but we just had all that conversation about those victories that we had with DACA and with all of those different things with undocumented students yesterday. And so I'm sure that's going to play a role. Those kinds of decisions are made through financial aid. So I don't really want to, state yes for sure they're eligible. But from my understanding, they're going to be eligible to the financial aid just as any other student would be. So that's not going to impact them. So I could be wrong, but that was my understanding of that victory that we had with our DACA. So they would be seen just like any other student through their financial aid. And those things, like I said, are outside of us. That's based on their tax returns. That's based on their own financial situation. That's how they get their financial aid award. And so, if they're not filing taxes here, financial aid already has their system of how they're dealing with those particular students. And I see, how close could this new affordable housing for FCC students be to campus? Could we almost make those dorms? Okay, so there's been so I've been here 8 years and I've been approached 3 times by large donors who want to build housing for Fresno City. The property around Fresno City is extremely hard to access, meaning there isn't really property available. And so that proximity will be a challenge. Those are going to be conversations that we're going to have. And Fresno City can go on the record and say, we are not going to ever operate dorms. Like, we're not interested in operating housing like that. We're not a housing provider. We have housing providers who can do that better than we can, but we have resources that we can provide students. So we need to partner in order for us to make those things happen. But we will not have dorms. That's not something that we're ever really going to pursue. Let's see, are there priorities at MAP that are federally mandated, like particular populations get first priority? I don't know. That's a question for you, Maria.
So I would, so through the coordinated entry system, I would say, and because MAP is part of the coordinated entry system, anybody that touches or homeless response system, we do categorize, like I mentioned earlier, we do take in consideration the highest needs, the higher acuity of the person, and the length of homelessness. So that's essentially the top 3 categories that we look at to prioritize someone that's experiencing homelessness. And essentially those are prioritized for more of the permanent supportive housing programs, because there's always a very low turnover from, as there is no time frame that people can stay in that program. we actually had success stories where people were able to regain full stability. You know, they increase their income and they're able to graduate from the program, and then that space opens up. So because we were so limited on permanent supportive housing stock, that's why we have a prioritization system.
Right. Okay, so I think we just made it on time, and I know we don't really have time for any other questions. So for now, I'm going to be sending out my email to all of you and just thanking all of you for attending our session today. So again, if you have any challenges with students that you really feel concerned about, we'll take them on one by one. And thank you so much for everything and for coming to our session. And if you have any questions, I encourage you. I'm Natalie Chavez, natalie.chavez at fresnocitycollege.edu. And good luck this year.
Okay. Natalie, can I just mention something? I'm gonna type in the chat box my community coordinator's information. So if anyone has someone that's at risk of homelessness or that is experiencing homelessness or has some sort of housing crisis, they can always reach out to her and she can link them to any of the access sites and try to get the services to that person.
You know what we'll do, Maria? We'll email it with my email.
Oh,
so,
okay.
Because people are already logging off because it's 12.
Oh, okay. So, I'll send it to you and then you can forward it.
Thank you, everyone.
Thank you.
Thank you, Natalie.
Bye. Good luck, everybody, this year. I'm going to stay. Maria, are you going to stay for a minute? I'm just going to stay here and see. Like, I think people are all leaving. You guys are all able to leave. Bye, everyone.
Thank you, Natalie, Maria.
Bye, Linda.
Bye. This is awesome. Thank you so much.
Bye. Have a good day.
You too.
Thanks. I think everybody's leaving one by one. So we'll just stay here, Maria, and then like you. So I mean, some people may stay to talk to us, but who knows?
That's
I think
fine.
most people have left the room.
Do you want me to stay just until everyone's completely
Yeah.
just to
Same.
make sure?
I'm doing the same thing. Yeah.
Okay, that's all.
We'll just
For
all.
some-
here.
For some reason, I thought it was going till 12:30, or unless it's already 12:30.
Hi.
No, we're an hour. We're hour.
Hi.
Hi.
Hi. Sorry, I'm coming in at the end. I was hoping to get in on this, but our faculty meeting went longer than it was supposed to. But anyway, I'm Abby Schrager. I know it says Jeff Schrager. It's my husband's account.
It's okay.
I'm adjunct faculty in the dental hygiene program.
Okay.
In Allied Health Services, and we have a property over in the Tower District.
Nice.
It's a 5-bedroom, 2-bath, and we've kind of deemed it as the hygiene house. We've put hygiene students in there that are going through the program, as well as some nursing students. So we try to keep the rent very low and affordable for the students, but I didn't know. I just wanted to make.
Please contact me because I can help link. We can have a conversation offline because I have students that will be looking for housing. So that would be perfect. That's a perfect idea.
So I did put it on the housing list over through student services.
Okay. You and I can actually have a conversation because then I can share with you a little bit more about those specific, because there are different populations that we don't need to talk about right now. But like if you want to email me, or I can email you, we can have that kind of conversation because that'd be perfect. We have plenty of students that need housing.
Yeah, I just heard the very end where the properties were hard to obtain and you guys weren't in
Extremely difficult. So yeah, we're working with anybody who would be willing to give a student a chance because they don't have credit, a lot of them, or they have poor credit.
Right.
So that's part of our challenge.
Okay,
right?
great. Awesome.
Okay, so yeah, I'll be sending out my
We're going to email
email to
your
everyone.
information.
Huh?
You said you were going to email out your. I got your name, but it's just at.
Natalie.Chavez at FresnoCityCollege.edu. Okay, everyone. I think everybody else is gone. Thank you for staying.
Thank you. Sure.
Okay.
Thanks. Bye.
Bye. Okay. Mercedes, I think we're done. I think everybody's gone now.
Sounds good. Thank you.
Well, there's Elizabeth here. I don't know who Elizabeth is.
Oh, it's just with Susie. I was just helping
Okay, I'm just making sure. I don't want to leave anybody if they have questions.
No, you're fine. Yeah.
Okay, thanks guys. You guys are awesome. Couldn't have done it without you. Have a good day, everyone.
Good day.
Okay, Maria, just send me your stuff. You and I will like connect and I'll get your, I have your email. So we'll just do an email and then I'll send out a group email to everybody.
Awesome. Okay. Thank you so much. Have a good day.
Thank you. Bye-bye. Good job, everybody. Oh, what's wrong with my computer?